Welcome to Health and Living with me, T. Shao Ik, and my guest for our Be Fit Malaysians series, Dr. Harjeet Singh, consultant orthopedic surgeon. It is our third and last episode of the three-part mini-series that we've been doing, looking at the recovery process after a knee injury and surgery. And we've been joined by Jimmy, a knee surgery patient, on what his progress has been like. He gave us some background about how the injury occurred, how he went through the surgery, and now we'll be looking at his progress about 4 months after his surgery. And also joining us, Joerg Teichmann, a physical and sports therapist, who will also shed more light on what happens during the physical rehab process and why or whether it is still vital when patients are starting to be on the mend. How are all of you today?
I'm fine. We are raring to go.
All right. So just some background. Jimmy tore his ACL, that's the anterior cruciate ligament, back in August 2020 when he was playing futsal. And I remember very vividly in our first conversation together, Jimmy, you described it as, hearing a pop. And you had knee surgery to repair the tear at the end of May of this year. And when we last caught up in July together with Dr. Harjeet, Jimmy, you were going for physiotherapy 3 times a week. And at that time, you were saying that you were already able to move around without crutches or without braces on flat surfaces. And you were going for walks as well. But you were still trying to not push things too much. So now, 4 months after the surgery, how are you feeling and how much weight can you put on your knee now? What kind of progress have you made?
Well, I've graduated from walking to light jogging. My therapist has put me on the treadmill, but I was confident enough to also do it on a regular basis at home and on the streets. I've actually got enough confidence to actually go on some light trail walking, and I've been doing that for a month already.
So, Dr. Harjeet, just for context, at this stage, how much would the surgery site and the injury have healed?
Yes, okay. I think that's a good way to start. I always do explain to my patients that as they feel that they are getting better, they have to be mindful that the anterior cruciate ligament graft still has a whole way to actually recover and get strong enough for sporting activities. So if we look at it, the first 8 weeks or so, we call it the inflammatory phase. So the graft tends to be more swollen, it's undergoing necrosis. That means without a blood supply, the cells are dying off. And therapy at that time concentrates on getting back some amount of soft tissue and muscle function, but most of the concentration is to keep the knee no longer swollen and less painful. That's one. Now, this continues. If you look at scans that we do, up to about 6 months, the graft still looks very swollen and angry, and the signal changes thereafter with proliferation. That means there are cells being placed in to make the graft stronger, and that occurs right up to a year. And following that, there's maturation of the graft. So although if you look at this kind of microscopic timeline, it seems that the graft is only going to be good enough beyond a year. We do find that it's not only how the graft looks, it's also how the rehab is done. The body is not a simple machine. There are so many things functioning at the same time. So we strengthen the other parts out and we get better results. So that's what rehab is all about. It's understanding where you are, making the patient to understand it, and then the surgeon has the confidence in a good rehab physician, and everything comes to place.
So, Joerg, if you could step in at this point, what is the role of rehab and physical therapy that at this about 4 to 6 months after the surgery?
Yes, this is what Harjeet said already. It's totally right. We also have a straight feeling, and what I say every time, in sports science, it's very simple. We said the training, adapt to the body. Here, it is very important that we keep this. So everyone is different. You think about yourself, Jimmy, Harjeet, myself, we're all looking different. And everyone said, oh, we have protocols. I'm actually a bit against protocols because we are different. Yeah. So someone have a very good wound healing. Someone have a very good adaptation in the muscles. Someone have a very good coordination and balance. Someone don't have it. But why every time we treat it in the same way? This is totally wrong. Rehabilitation means individual. I want to bring the people in their best level. But when I follow protocols, I have my doubts about that. And rehabilitation is a little bit different. I want to see the individual, how I get him up. Where is his weakness? Where is his strength? So we can do this with very good testing, batteries, good assessments, and then also the people feel very happy, to see their progress in their rehabilitation or training. And this is what I call it a good rehabilitation training.
So it was brought up in our last show that, this line I want to repeat here: surgery is an event, but rehab is the marathon. Your experience of keeping people in that marathon, what are the challenges they face? Do they drop off? How do you get them back?
Yes, I mean, there's a lot of difficulties that you see. Number one for me is every time your head, your brain, you want. And sometimes, of course, you also get some issues where you think you're not coming forward. You're facing these issues. I don't call it problems, but in the end, I said it before, everyone is different. So overcome your fears as well. Think about, you want to go back to sports or you want what you like. For me, I say it very simple. Daily routine and daily activities is a big difference. Daily routine, I can brush my teeth, but daily activities like for Mr. Jimmy, he wants to go back to his football. And maybe still in his mind is thinking, oh my God, I got injured. I can't do this anymore. How overcome these obstacles? And this is not easy. So you need time, special treatment for these people to bring them back to their normal daily activities. Daily routine is different.
All right. Jimmy, how are you feeling about rehab? Any issues that you've been facing?
Actually, I'm quite happy with where I am right at this moment. I still keep to my 3-day-a-week routine. I've moved, from resistance band to muscle building and overall strength. I'm feeling quite good, which actually gives me the confidence to, make that decision to kind of go on light trails and then move to like different trails, different levels of difficulty. But, with some calculated, risks. So I feel quite good working with my physiotherapist, him telling me what I can do, what I can't do. I'm sure my surgeon will be saying, are you sure you're going to do this? But I see my physiotherapist 3 times a week. During this MCO, they're the most outside person that I've seen, and we've become like family. And then he says, go run, go and do this, So that gives me the confidence, going through, the workouts that I have in the center, knowing my strength. I feel when I do my leg presses with my physiotherapist, I'm very happy, because the power that comes out from the injured leg, it's I think more than a normal person.
All right. And you are measuring, I guess, by looking at your ability in doing those kinds of exercises. What about the daily routine kind of thing that Joerg was talking about in terms of you being able to function as you did before? Yeah.
So, if I don't think about it, I go about on normal. I don't walk with a limp. It's those who have not seen me through the MCO or even know that I had gone through surgery would not even know that I've been through a major knee surgery. That is quite important, and I think it's quite a fast recovery for me because I've been walking comfortably I think after 8 weeks to 10 weeks.
All right. Look, we'll come back and look a little bit more at sort of how three of you are working together or would be working together in a situation like this to ensure that there's no conflict. You are talking to each other separately as well. How does that play out? What are some of the challenges that you have come across? How to overcome that? I'm speaking to consultant orthopedic surgeon, Dr. Harjeet Singh, Jimmy, a knee surgery patient, and Joerg Teichmann, a physical and sports therapist. This is the third episode of our 3-part mini-series on the recovery process after a knee injury and surgery. We'll be right back. BFM 89.9. Welcome back to Health and Living with me, T. Xiao Ik, and my guests joining me via Skype, consultant orthopedic surgeon Dr. Harjeet Singh, Jimmy, a knee surgery patient. Both of them have been talking about Jimmy's recovery and progress after his knee injury last year and his surgery earlier this year. Joining us also today, Joerg Teichmann, physical and sports therapist, to really focus on the physical rehab side of things as we look towards the longer term recovery process. We're looking at a sort of tripartite here. There's the surgeon, the physiotherapist, and the patient or the individual. And you are, managing different aspects, each of you. Are there times when there could potentially be conflict in terms of setting goals or milestones? And what happens in that case, Dr. Harjeet?
I think the modern surgeon has moved off from being very time-based in accessing recovery to being very goal-based. Being very goal-based allows you to individualize your expectations and wants for the patient. Now, similarly, the physiotherapists and rehab physicians and trainers that I deal with also have the same concept of individualizing care and rehab. So we do know that there are certain changes that go through a knee that has been operated upon, but we also know that the biology of healing is not totally similar for everyone. So the initial part after surgery, I do see my patients a little bit more often to pick out the early problems of surgery. I think beyond 4 to 6 weeks, I actually let them be if my therapist is totally on the same book, and we actually discuss what we think about and for the patient way before surgery. This is not something that we look at as problems crop up. We kind of know that, okay, say for example, say Mr. Jimmy, okay, we know that he's a bit gung-ho, his pain tolerance is good. Sometimes he will overpush himself. So when he does come, and I think that things are a little bit more at once than I would like it to be, I assess his knee. And if his knee seemingly can take that excessive load, it's just that Jimmy is probably different. Individually, Jimmy is different from the normal patient. So I let it go and let it be. But at the same time, we are mindful if doing something new or increasing the load of rehab or changing the protocol, so-called protocol for that particular patient of his rehab results in a change, maybe swelling, increased pain, which is persistent, then we tend to scale it back. So it's actually a lot of feedback from the patient, from the therapist, and my input. Now, ultimately, I think this is only possible if you trust your rehab team and they trust your input and everybody is on the same book. I think that's modern medicine. You work as a team and we all know where we stand in that marathon and what we're supposed to do, and we let it be sometimes.
Your perspective?
Yeah, I can only agree what Dr. Harjeet said. The most important thing is communication. Talk with each other. Very important, yeah? And don't say, oh, I know everything, yeah? That makes no sense. Also trust your patient when he said, look, I feel pain, accept it. And don't say, oh, my protocol, we are coming back to the protocol, say this. No, trust your patient. When he said there is pain, stop it. There is millions of variation what you can do to bring him up there. It's not every time one cookbook, but I call it there's a lot. So modern medicine, when we are coming to this, it's also for me, trust each other. The trust between the doctor, the patient, the therapist. Yeah. When this is there, it's the best thing. Yeah. And sometimes also it's good, call the doctor, say, look, I have this problem. What you think about it? Don't hide it. Bring it straight forward and say, look, I guess I did a mistake. There's nothing wrong. We are humans. We can make mistakes. Yeah, but change. Don't put it, but we call it under the carpet and leave it. And the doctor's wondering what's going on. Because the patient sees you every second day. He trusts you as a therapist. Yeah. The orthopedic surgeon, yeah, he only will see him after the surgery, maybe every week, and then maybe every 3 months. But he sees you every second day. So the trust is so big. Don't disappoint him.
So what would be some signs that things are not going as planned? You need to change things up, admit that there's been a mistake. What are some signs you're looking for in the clients that you're working with?
But Jimmy said it very well. He was able after 8 weeks to walk normal. So for me, yes, there's a timeline. But when someone is not able to walk properly in a right gait, there's something wrong. So you have to think what went wrong. Why? I call it every time when you think about after a surgery, we have a lot of receptors giving signals to the brain. And I call it highways from the knee to the brain. Suddenly, this highway is construction site, surgery, but yeah, someone did. So that means these receptors have to go a different way to the brain. When you see people, why they are limping and it looks like they have a hip injury, but they have a knee injury, something is a wrong signal to the brain. And after maybe 8 weeks when something is wrong and he is still limping, maybe the receptors giving a wrong signal to the brain. How I can change this? Which kind of exercise or physical therapy I can do? For me, it's the best. People, when we walk forward and they are limping, I said, okay, guys, try to do me a favor, walk backwards. Suddenly, when they walk backwards, they don't limp anymore. Why? You change the pattern. And the receptors give a new signal to the brain, and suddenly you change also your muscles what you're working on. And he said, oh my God, this looks awesome. I say, exactly. So it's nothing wrong. Everything is fine. It's your brain sending something to you what is not right. And the people after that, so you walk with them 5-6 times backwards, and he said, now you walk forward, and suddenly they don't limp. Wow. Oh, how you did this? I said, it's simple. Yeah, it's biomechanics. And you see, there are so many things, but we can influence in this rehab program. Variation is very important. I guess when you ask Mr. Jimmy later, he's not every time doing the same, call it rehab program. He changed. The brain needs variation.
Jimmy, you want to give us a picture of what rehab looks like, what kinds of variations you've gone through?
Well, I think firstly I want to agree with Dr. Harjeet and Joerg that the communication was quite key. I'm not sure whether it's like a Malaysian thing, when your therapist asks you, how do you feel? Okay lah, so we just say, okay, so my therapist always taught me, okay, what is okay? So I communicated more and I said, actually I feel there's this tightness here, there's this pinch here, I don't feel comfortable, or I did this and then I'm walking, I feel this slight nick here. So this little stuff, after my sessions, they try different methods to help fix the very specific problem. So if I don't communicate with them, it would have never gotten addressed. So I think that helped me a lot and allowed me to recover faster. And Joerg saying, the trust factor, I trust the therapist, when they say, actually you can run, actually you can do this. There are times when I think I could do more. So I'm still doing all this resistance band. It's easy. I wish I was doing more weight training, but in my mind, I think they know better. I'm not ready for the weight training, so I leave it a lot to them to tell me what I can do or what I can't do. When resistance band got easy, they added more stuff, variations to the exercise, and then I'm on some wobble board, and then they added some weights to it. So every time something got easier, they just added more things to make it more difficult, and that made it not as boring as well. Almost every session had some new exercise to go through.
So there's a bit of a learning curve, isn't there? And I find that's a big issue for many of us. We don't listen to our body, and therefore we don't have the vocabulary to communicate what exactly feels right or wrong. And I like how you explained it, Jimmy, that your therapist, prods further to try and find out what exactly do you mean by okay. Pain, I know Jimmy is a model patient. He doesn't talk about pain at all in the last 2 episodes that we've done as well. You're like a robot, Jimmy. But realistically, Dr. Harjeet, at this point, pain management, what are some of the issues?
I think at this point, if the patient is extremely comfortable, I think as the muscles get stronger, you may get a bit of soreness with increased activity or change in the kind of activity that's done, but pain is never an issue. Now, an inappropriate amount of pain, which is curtailing a progression in rehab, is things that I look out for. So similarly, when I was a bit greener in practice, we tend to be very restrictive in our wants for the patient after surgery. Then we slowly realized that some of my patients who never listened to me completely did a little bit better than the ones that did. Okay, then we moved on to there are certain big no-nos and there are certain things that I would accept and watch and see and how it goes. And that makes the surgeon better and better because, the material that we learn most from, other than our journals and books and research material, which is all lab-based, is actually from our patients. So if you have a patient that understands his body, understands the signals that the body gives in response to what he's doing, then it's very difficult to go wrong. Now, if you have a patient who is able to communicate, or you teach them to communicate, I tend to tell them what to look for. They tell me they want to do more. I said, okay, you work with your, as rehab pushes you, but you watch for this and this. Now, if that happens, then, maybe you need to tell the rehab and then they will communicate back with the surgeon. And then, you tend to formulate something which is a little different, but going towards the same goal. So I think it's very, very individualized. Possibly the only time that there is a certain structure is to initial part of rehab, initial part after surgery, when a lot of it is to protect the operated area so that you don't have immediate mishap when everything is weak. But after that, it's just as you move on further, because the idea is you need to get the part moving better, getting more flexible, getting stronger, gaining balance, going back to full function, and then going back to whatever sporting activity that the patient wants. So there's a whole structure to it. But there's no definitive point at which you go from one to the other. It's all very blurred. So as you add on something, you look at the response and you move on further. So that's what I do. By the time that, the patient's 6 months, I'm just basically, when I look at them, when they walk in, I look at the gait, I already know that this guy is totally fine. For me, if you can get someone after surgery within 6 weeks to walk comfortably, that if he's wearing a pair of jeans, you don't know which side you operated on, unless you look at your notes, I know I've got a winner. and then I just work. If you do not gain the ability to straighten the knee, you lose your extension after an ACL surgery early on. I think those patients are in trouble for the long run. So with experience, we pick up these kind of small problems. The rest of it is just kind of autoplay sometimes.
But in that situation that you mentioned, how would rehab play a role there?
Okay, for me, it's also pain is one thing. When you have a muscle soreness or muscle pain, it's fine because we want to work on the arthroscopic muscles. When you have an atrophy, we know that, and sometimes, it can be quite big. When you measure the muscle skirt, especially in the upper thigh, it can be 4 to 6 centimeters. So you want to reduce this, and you have to destroy what we call it the old and injured cells. So we need to know how you do it with hypertrophy training. I don't want to go inside these details because it's too long. But when you have a joint pain, immediately what I call the alarm bells have to ring, because then you did something wrong. Muscle pain I will accept that this is normal. Joint pain I can't. And especially when you have swelling, so you did something wrong. Or the patient, but you even don't know, because sometimes the patient, they come to your therapy and then behind your therapy they're doing something else, and you have no clue. But a lot of people do that. And then you say, what you have done? Oh, sorry. You say, oh my God. I say, now we are facing big issues. We had it, a lot of people, when the orthopedic surgeon said, look, we have to work on your quadriceps. Vastus medialis, totally fine. So people going maybe in the gym and say, okay, the personal trainer said, leg extension, the best thing to bring it up. But we as therapists thinking immediately, oh my God, be careful. Because when you think about the biomechanics in your knee joint, the liver is very low. So you push with 30 kilos against your knee joint, that suddenly over 90 kilos, you have a shifting effect. And that can cause you the swelling in the knee. And you, as a therapist, you didn't even know about that because your patient did it behind your back and you said, oh my God, what I did wrong. But actually, you did nothing wrong, but he did something. So then you come back to the trust, that the people really trust you and say, yes. And this is why we call it every time in my clinic, you have to do testing. That also is very good for the patients to see where is my result. Which kind of ankle, when you think about leg press, isometric, how is your strength? You compare the injured leg to the non-injured leg. And you can start, because everyone knows, some doctors maybe say, oh my God, after 6 weeks, you put them already on leg press. I said, yes, because in 60 degrees, there is no stress on your meniscus, on your knee joint. And isometric, I do it maybe for 3 seconds, but I know the strength. And make it simple, you have a patient, his weight is maybe 70 kilos, but he's only able to push 35. He never can walk normal. And with his non-injured leg, he can push maybe 140 kilo. So there's a difference from 100 kilo. And then you have to bring these guys back to normal. When you say, look, our target at least 85%, injured to non-injured. And this, what we call it, is the key to success in rehabilitation as well. Know exactly when you come from phase 1 to phase 2, from phase 2 to 3, 4, 5, which kind of testing you can do with these people and patient to get them there. And the more testing you do, the more data you have on your patient. So much easier you can do a program for them.
All right. So the key thing I'm taking away is don't cheat on your therapist.
And doctor.
And your doctor. Okay. Yes. We won't forget you. What are some other common mistakes that individuals might be making at this point? Pushing too hard, that kind of thing. Anything?
Okay, I can probably add this. I have patients who are too fearful to push. We have been talking with Jimmy, who seems to be some kind of demigod of rehab after surgery. But
That's right.
we also have patients who are very, very fearful, and I find getting recovery in them is much more difficult than the ones that I need to, make sure that they are not pushing themselves too hard. Because, and I find the battle is not at the structure which you repair, the battle is in the mind. So that's the one I normally speak more to my physiotherapist who meets them, much more often than I do. And I say, hey, you know what? Structurally, I'm testing him. The knee is fine, but he's so fearful. Maybe you need to work on him more, and talk to him more. I can't seem to get through to him. Then we work on it. So for me, the challenge is always those who are fearful. Is a one subgroup that I actually have trouble with.
Joerg, would you like to add to that, or any other issues you see?
Hard to say fearful, but we have also people who overuse themselves and they want to go as soon as possible. And I guess Harjeet and Jimmy will laugh, but I said a lot of people using right now Dr. Google. And Dr. Google say this and Dr. Google say this. And I said, guys, it's very simple. When you check Dr. Google, you have maybe the same injuries, but 350 variation. Trust your people you work with. And this is very important because we have this every day in the clinic. Oh, I read this and say, yeah, you check Google. Yes. Okay, fine. But the new world, we have this. You have to accept it, but try to bring them down and say, look, unfortunately, we have it black and white. And then we come back to the testing. You are not able to do this. You can do it when you want, but better than you leave the clinic. I have to be very clear because I don't want that you destroy yourself. And this is what we are facing sometimes because, I read you can't, especially after ACL reconstruction, I read it, you can't be fit after 4 months. I say, I'm not God, sorry. Accept, yeah.
And that fear that Dr. Harjeet described, how do you deal with those who don't want to push?
Okay, you have this, and you as a therapist, use your communication skills. Try to convince them that you say you can, yeah? But people have fears, what we understand. Try to find out what is the reason why they have fears. Why they are afraid to push maybe a little bit harder. Maybe they have bad experience. Can be a reason. And for me, when it's coming to therapy also have to be fun. When you do every time, what we call it monotony, every time the same, I don't have any pleasure to go, but I put variation inside. So we said, you do some balance exercise. Then you say, look, on the floor, then you go a little bit higher. You put them on a wobble board or on a pillow. And then you do expected, unexpected disturbance. Every time you try something new, that the people really enjoy this, I guess the fears will be broken soon. And then you can go forward. Yeah. But when you have what you said, we have to do this, makes no sense. When you come back, yeah, the body adapt to the training. Yeah. So enjoy. And this is very important. You have fun. You have to be fun.
Jimmy, do you enjoy therapy?
Yeah, I like the challenges, and I like that some of these exercises that I go through give me the confidence, when I still remember when I first had a task which was to jump and land on a single foot. You had to land and balance on your weak foot and on your okay foot. I realized that not looking at my feet and thinking I'm injured, it just do it, And then when I landed, it was very natural. That's when I realized, hey, I can do this outside. That's when I thought, yeah, I can. I think I can. I don't feel any pain. I can go and do my trail. So you reach certain milestones and you realize, this actually stimulates, walking, or. So at the comfort of the therapist, you're doing your jogging and doing all your jumps and balance. These are all simulating what you're going to go through. So it gives me confidence, and that's what I needed to push myself outside.
And what are you thinking about looking ahead, say, past 6 months to the 1 year mark?
Well, my surgeon would disagree, but my therapist says I could possibly play football in
Tomorrow.
2 months' time.
How realistic is this?
I think maybe a very simple kickabout, but very mindful. I think I am very mindful to not pivot too much. Still know my limits. Don't go and play a full crazy game. A kickabout, a light one. I think slowly building that confidence and not going back to square one. I think that is my main goal. Don't go back to square one.
So Dr. Harjeet, how do you frame that planning ahead?
Yeah, so if you look at why we come to this timeline that we tell them, okay, 10 to 12 months, and then I keep on shifting it here and there. The reason is that this is all through research, and we look at a whole big group of people and when they actually recovered. And whenever we do that, we get like a bell curve. There is a whole large amount of patients who will fall right in the center. And then there'll be these overliers and underliers. So it's nicely like a bell. Now, we sometimes, maybe, if maybe by God's grace or nature's grace, Jimmy falls in those that recover faster, regain everything because he followed his rehab and his body heals well. Maybe he's the one that's going to be able to play at 8 or 9 months. So for me in my practice, I'm in private practice, so we try to undersell and over-deliver. So we tell them 11 months, and then when they get 9, we are also applauded. Now, I can share a story of one of my patients telling me that Zlatan played back when I think he was about 5-6 months, and my reply to him was that you are human, because we all know that Zlatan Ibrahimovic is not human. So, there's so many things that we don't have a perfect answer for, but we do know the biology of healing. We have imaging studies telling us that this is what it is. We have advances in rehab, which tells us that every person is an individual, and if they can hit their marks, they can move forward, and some of them would be able to recover faster and get back to whatever they want to do. Now, 7 or 8 times, Mr. Jimmy has used the word confidence. I think that's very important. If he's going to move on and he's confident that he can, and seemingly his communication with his therapist is top-notch, I'm sure that works. Therefore, I think it's safe. I still feel he's going to stress the shit out. I mean, he's going to stress his surgeon a lot. but I think, if his surgeon is worth his salt, he can take it.
Well, I hope he is. Joerg?
Yes, what Dr. Harjeet said, I have also something additional. There's a lot of research going around, but it's also for me, who they have done this research. There is a big difference between trained and untrained people, because a lot of sport injuries occur with people, or after 10 years, I can play football, and then they twisted her knee, and that's it. You have an ACL. But when you have good trained people and they have this, their adaptation is much better. Yes, Harjeet is right where you said, okay, target 8 months, 9 months, yes. But some people are, when they are well trained and they had maybe time also do a pre-rehabilitation program, I'm sure they will be better. We can't say recover faster because everyone is different, but I guess they feel better and they are maybe touching their targets faster than anyone else. And you have to see this. Most of the guys what we are dealing with, yes, they call it, when you ask them, because we have every time classification, you are trained, you are untrained, you are advantage or high performance. Huge difference. Because all these 4 groups have to be trained or rehabilitated in a different way. Yeah. So when what we call it sometimes untrained people, you get maybe a strength improvement from 15 to 20%. In high performance, you can't expect it. You got maybe 2%. So you can't compare this, because you have to learn to read these testing results. And this is quite a good point when it's coming to rehabilitation. You said, look, cool down. We are not there yet. Or why not? He told me I can. I said, no, it's wrong. You're not there yet. Yeah. You train maybe 5 times a week. I call it now karate, and you are fit. And this lady there, she's a housewife. Yeah, she fell down the stairs, ruptured the ACL. We can't compare both of you. This is a mission impossible. Yeah, and this is also the difference where you have to come. Yeah, and I'm sure this karate guy is in his head much more confident than this lady as a housewife and she fell down the stairs. Because she is afraid to do that again. Yeah, a karate boy will push and he wants to get fit fast, but you have to, maybe sometimes we call it the brake pedals. Stop. You can't. Yeah, but I want to say, okay, it's fine, but step backwards. Yeah, there is a biological limitation, I guess, and Harjeet can tell the people much better than me what it means, biological limitation. We can't overrule this. This is given from God.
So Zlatan's advantage is both maybe some biological genetic advantage, but also his training, his conditioning.
Yes.
Yeah, don't compare yourself to Zlatan, okay? But you know, we talked about rehab being the marathon, right? It's also this long-term relationship. But how long more will someone need rehab? If we're looking past 6 months, we're looking at the 1-year mark, perhaps.
Okay, I guess from what I said, after 6 months, I said already we have this 5 phases of rehabilitation, what we call it mobilization, stabilization, muscle build up. Then we call it sports specific. Yeah, and then we call it prevention. When we are coming to prevention phase, and this is actually after 6 to 7 months, approximately. Yeah, you don't get, yeah, that we said, look, you can do actually your prevention program on your own. But will be good when you can come maybe every 3 weeks, that we can check, do some testing with you, balance, coordination, strength, explosive power. And there was a very good publication what came out that they tested people and they did the drop jump with both legs, injured and non-injured. And they realized actually, this guy was after 8 months, then they realized, oh my God, the flight time and the contact time on the injured leg is so slower than on the non-injured leg. So there is something wrong. And then we come back to Harjeet, this, what we call it fears or phobia in sports. Yeah, medical, they call it now kinesphobia, the afraid of movements. And then you have, as a therapist, you have to go straight inside there and say, we have to work on that. Because when not, maybe you can't play again. Because this is still inside your head. So bring it out, yeah, why you still have this phobia to do turning, man-to-man situation, all this stuff.
So this wraps up our 3-part mini-series on, you know, recovering from a knee injury, and we've really covered it from as many perspectives as we possibly can. Can I get a message from each of you to just a key takeaway? Jimmy?
Going through, I think, my physiotherapy, I realized, you know, that actually it's quite easy because you're told what to do. So rather than trying to figure out yourself, you know. So I mean, I have the luxury of being able to go to see them 3 times a week, you know, and they tell me what to do. You know, I can be lazy, you know, have my lazy days and say, you know, oh man, you know, but then going there, then do this, you know, how many reps, how many sets. So that kind of, in a way, made it easy for me, for my recovery, for my own betterment. I think at least in the beginning, everybody who has an injury to go there to learn the basics. I do have my resistance band and some equipment at home, which I can do on my own thereafter. Which I do on the alternate days. At least get some direct info from your physiotherapist and to give you some direction.
Joerg?
Yes, for me, for everyone, accept your injury. You can't change the past, but you can change your future. And this is, for me, the most important thing. So look forward. Yeah, trust your therapist, trust your doctor, and he will help you to achieve your daily activities.
Dr. Harjeet?
Yeah, I think mine is that I think this series has probably told us that recovering from an injury appropriately is a marathon and not just a sprint. And, the physician, the treating surgeon, the patient, the rehab physician, the therapist, they all need to be on the same page of the same book in order to get as perfect recovery as we can. Now, we've always said trust the surgeon and then trust the therapist. But, sometimes as I get older and gray, I also realize that we have to trust the patient. And most of the time, everyone wants them to recover well, and that's the way we go.
All right. Thank you so much. I've been speaking to consultant orthopedic surgeon Dr. Harjeet Singh, Joerg Teichmann, physical and sports therapist, and Jimmy, a knee surgery patient. This wraps up our 3-part mini-series on recovering from a knee injury. You've been listening to Health and Living on the Bigger Picture, BFM 89.9.